Good morning, friends. For today's video, we will talk about how to take care of your teeth and mouth. So, if you are interested, please keep on watching. So, the first step is you have to go to your dentist regularly, ideally after every 6 months. In special cases, your dentist might suggest that you should visit a dental clinic after every 3 months. Like a regular medical checkup, you should also visit a dental clinic also from time to time. We also need to take care of our oral health. Your dentist or dental hygienist are the only people who can remove plaque, calculus, or tartar in layman's language. They are also the only ones who can access or give advices for the best treatment plan for you. The dentist can also teach you how to properly clean and brush your teeth. The second important step is the proper and the effective toothbrushing. You might brush your teeth every day or twice a day, but the question is, are you doing it correctly? There are some rules in toothbrushing. First, you have to use a soft bristle toothbrush or an electric toothbrush and not the hard ones. The toothbrushes with the hard bristles are so stiff that it can not be bent and move against your tooth surfaces. So the tendency is that it may cause abrasion that will lead to sensitivity over time. The second point here is use BAS technique of toothbrushing. This is a combination of circular and horizontal technique. The circular is the most simplest one, but it is the least effective. The horizontal brushing, on the other hand, is the most common one that we do. So the proper way to brush your tooth is to tilt your toothbrush by 45-degree angles back and forth, and also in a circular motion with a gentle pressure. Brush all the sides of your teeth, the facial, the chewing surfaces, and all the other surfaces. The third point is don't forget to brush your tongue with the help of your toothbrush, or you can use a tooth scraper, a tongue scraper. This is to remove the bacteria from your tongue and keep your breath fresh. The fourth important thing is that we forget the most, that we should brush our teeth strictly for 2 minutes twice a day. And the fifth point is we should use a pea size of toothpaste on the toothbrush. The sixth point is we have to replace a toothbrush after every 3 months, or if we see that brushes gets frayed or gets destroyed already, then we have to change a toothbrush. It is not effective anymore. The seventh point is we have to always remember not to rinse our tooth after toothbrushing. Also, we have to wait for 30 minutes before you brush after a meal. The flossing is important because our toothbrushes cannot reach the area or remove the debris that we are not able to reach. The ninth point is use mouthwash. You can use it from time to time, but always remember to not to use it after brushing. The mouthwash also reduces bacteria inside our mouth, so it is also very helpful. The 10th point is avoid food high in sugar and carbohydrates, because carbohydrates feed the bacteria in our mouth, so they will stick to the tooth surface, and as a result the bacteria will stick on them, and it will cause killing. Point is we have to avoid eating hard foods, those food that are difficult to bite. They can cause fracture, or it may chip off your tooth surface, because when that happens it's possible that you might feel sensitivity, or in worst cases you will need RCT. The 12th point is avoid eating or drinking extreme hot or extreme cold food and beverages, because our teeth will go through a lot of expansion and contraction. If you are always doing this activity, then it will also cause sensitivity and even pain over time. The 13th point is we have to limit the intake of colored drinks like coffee or tea. I'm not telling you that you should stop drinking it, because I also like tea, but I'm saying that you should limit the times you're doing it, because it may stain your teeth and it will be hard for your dentist to remove the stains if over time we will not avail teeth cleaning. My advice is always to drink water after drinking these colored beverages, and properly brush your teeth at the end of the day. The 14th point is avoid bad habits like biting your nails, biting a pen or a pencil, opening a bottle or a bag of chips with the help of your teeth. It may damage your teeth, and it can also break it if we will always do these habits, and sometimes it will cause cracks or fractures because of the pressure that we use. Once a teeth chips off or get broken, the inside part of the teeth can be exposed. It will be sensitive, or in worst scenario, it will be very painful and you might require a RC. The last and the most important point is that you should stop or avoid smoking. Not only it will affect your teeth, but also our lungs. You will notice on smokers that cigarette cause stains or nicotine stains on teeth and gums. It will cause deep pockets, which will lead to gingivitis and more severely to periodontitis. So all these you should keep all these points in mind while brushing your teeth, and to keep your teeth and gums healthy. Aside from these, you should eat nutritious food and have a well balanced diet, and you should always exercise. So stay healthy and keep smiling.